Andy Johnson, Minnesota State University. We are looking at a diagnostic reading assessment. We've gone through all the parts, now putting it all together. Now remember, a diagnostic reading assessment is used to diagnose the causes of reading difficulties, word identification, fluency, and or comprehension. After this, after doing all parts of it, you should have a general sense of students' independent levels and instructional reading levels. This enables you to select the appropriate level of material for instruction and for students' independent reading level. Now, when students are reading for pleasure by themselves independently, they want to be able to read material at the independent reading level or below. There's no such thing as too easy when reading for pleasure. Now, the data you collected from the diagnostic reading assessment should indicate the strengths and deficits in one or all of these areas, comprehension, word ID, or fluency. You should also know what strategies the student is using to identify the word. You should have a very good sense of that by listening to the student read and analyzing the recording of that oral reading passage. You should have a sense of the types of letter sounds or patterns that are problematic. And again, you listen to the types of miscues and you looked for patterns. When you plan instruction, you should address the deficit areas, but you also have to reinforce the strengths so they don't atrophy. If word identification is problematic, make sure that you address all three cueing systems. For example, if students are having trouble identifying words, don't just do phonics. You can't let the other two atrophy. So you have to have activities to address semantic cueing and syntactical cueing. Now, for literacy, it does not work to use global goals on IEPs or other intervention plans. One plan does not work for all students. The goals have to be specific to that student, and they should specifically address three deficit areas or the deficit areas. An example, if fluency is a deficit area, you must have a goal specifically related to fluency. And here is a sane goal for an IEP or any intervention plan. Pat will read 100 words per minute. Simple, measurable. Benchmarks leading up to it, and it will be measured using timed readings with graded readers. Simple, simple, simple. If word identification is an issue, a goal specifically related to that. On a graded reader, Pat will correctly identify 90% of the words on reading level 4. Simple, simple, simple. Benchmark leading up to that. Progress monitored using running records, where you simply identify the number of miscued words and find the percentage. If comprehension is an issue, again, simple. On a graded reader, using narrative text, Pat will identify major characters, events, and settings with 90% success. Simple, simple, simple. Benchmarks, and then scores will be measured using a story retelling chart. Sometimes it's called a rubric. Putting it all together, the diagnostic reading assessment, I do not know how an IEP related to reading can be written without some form of a diagnostic reading assessment.